My name is Mark Travella. I'm an Associate Director of Transformation and I work for Essex Partnership University NHS Trustee. We already have a really good partnership with the voluntary sector, and here in Mid and South Essex with Trust Links, all the different services that complement the pathways that people experience as they go through a recovery journey, from clinical services through to transfer back into their local communities. For the future, we want to explore new ways of working that enhance the continuity and the lack of ending of one service and beginning of another. We want to rethink that. So we've got a more permanent, connected system working together to look after people's health, social care and wellbeing needs. One of the big differences I think that we've got to explore more is the longer term support and care. We see people as needing clinical services, as being unwell. And then when they've been treated, what really worries people, patients, carers, GPs and our staff, is that that isn't always a smooth process. And there's a lack of confidence sometimes that the system is able to respond to people's needs. And then, of course, when things change, people experience the fear of the delays, blocks, hoops that people have to get through to get back into service again. The big gap here is how we fix that so that there's a more sense of the voluntary sector and statutory services being one service where there's no kind of fall off the cliff edge to nothing or the worry that there's nothing there. And of course, there are great things there because we know we've been sharing our pathways and delivery together for years. But to improve it, I think we need a completely new way of working together. So in a new contractual ways and new ways of working, sharing, working in the same rooms together. So there's much more connected experience. And I think it's really exciting because I think that working together and learning from each other on the skills and the experience that we have, our expertise really does complement, because I think then we start growing, we start bouncing off ideas from each other, and we'll grow together in a much stronger way that we didn't have before. When we talk to patients and carers, and we talk to staff and to GPs, they really worry about the disconnect, the falling off the cliff edge. So I think what they'll experience, impactful, relevant service that encompasses people's lives, because people aren't a diagnosis or an illness. People's lives encompass their families, their schools, their work, their faith. So what they expect to experience is services working together to meet all those needs all of the time. And so I think people will feel it's much more safer, more effective and more appropriate.